Active and passive immunity. So these are going to be your humoral mediated B cells. So active and passive immunity are similar in some ways, but also different in other ways. So for your active immunity, this requires antibody production. The pharmacokinetics involve agents formulated with live or attenuated or weakened dead microorganisms. We are talking about formulating vaccines. So these are non-toxic, so we can use recombinant DNA wherein we alter the DNA material so it's not a full DNA, so it can have some missing stuff. That way it doesn't have that same toxicity or even same severity when a person is exposed to this material. Active immunity stimulates the body's antibody production against specific microorganisms. There's natural and artificial ways of providing active immunity. So the natural way is basically the production of our own antibodies during the actual infection. So an example of that is, let's say, a child who was infected with varicella or chickenpox. From being infected, the child develops its own antibodies that will make him or her less susceptible to another varicella infection in the future. On the other hand, we also have artificial active immunity. So this is a method of obtaining immunity wherein we inject toxoid in a patient, so weaken toxins in a patient or altered toxins in a patient, or vaccines. So this allows for our body to produce those antibodies without actually being infected. So that's what we do when we're giving immunizations or vaccines. Some selected agents or some agents for active immunity include your DTaP, your diphtheria, tetanus, and pertussis vaccine. So pertussis is basically whooping cough. This is a type of active immunity agent. Other examples include our seasonal flu vaccine or influenza virus. Then we also have Menactra or meningococcal vaccine, which prevents meningitis. These vaccines or agents provide immunity to diseases or illnesses. That being said, this requires time for our body to produce or form those antibodies. So not because, let's say, we got the flu vaccine. So if you received the flu vaccine and let's say you were exposed to somebody within 3 days after you got the vaccine, you may not be immune or your body may not be able to fight that flu because you didn't have enough time to form those antibodies in comparison to, let's say, obtaining the flu vaccine and then a month or two later you were exposed, then the infection may not be as severe or you may not even get infected at all. So depending on which agent, there are different timelines or schedules for when we administer these vaccines or agents depending on what disease that we are treating and also which specific vaccine that we are talking about. Usually many of the vaccinations are administered during childhood in order to make sure we have that help in our immune system in order to prevent certain infections that are common in children. Passive immunity, in contrast with active immunity, so this is very passive. Our body does not have to produce the antibodies. So we are actually directly given those immunoglobulins, those antibodies, and so our body doesn't have to work harder, and this is basically a quicker method of having that immunity. So these agents are formulated with immunoglobulins from humans or animals, and again this bypasses our own or the host immune system, so this provides antibodies or as soon as possible. So again, the antibodies are not produced, they're actually given, so this allows for faster response than active immunity. Now this is also used for prevention of disease as well as treatment, but faster than the active immunity. So there are also natural and artificial ways of obtaining passive immunity. A natural way is basically from our mom, so our maternal passing via breast milk, the placenta, the bloodstream during pregnancy. An artificial way of obtaining passive immunity includes immunization and short-term immunoglobulin. Some passive immunity agents include antivenin, which is used for snake bites, spider bites, and possibly scorpion bites. So this is to help with the venom or the toxin from the snake, spider, and scorpions. Digibine or digoxin immune fab is used to treat life-threatening overdose of digoxin. This one you guys have learned that in a previous unit. RhoGAM or RHOD immunoglobulin is used for Rh negative people who are exposed to Rh positive blood. So basically a pregnant woman. So this is given within 72 hours of exposure to Rh positive blood. Typically, it's during childbirth. So after childbirth, then within 72 hours, this medication will be given, and this will prevent formation of antibodies that attack Rh positive blood. This doesn't really affect the firstborn child, rather it may affect the child born following that first child if we don't give this medication, because sometimes the exposure to Rh positive blood when a mom is Rh negative can lead to an immune reaction, and so the second time around that it detects that Rh positive blood, then it may start attacking the fetus or the baby inside the womb. So that's why it is very important to test for their blood type and see if they're Rh negative or positive, and so that we can give the proper interventions after childbirth. Criteria for use of some agents. So again, agents provide treatment or prevent diseases and illnesses with exposure. Also, it will provide hosts with antibodies for rapid response. So again, we are giving the antibodies directly and we are not waiting for the body to develop its own antibodies. And the timeline for administration is variable depending on the agent and the disease process. And there are also labs that we have to monitor depending on what drug or agent that we are talking about. So if it affects your blood count, we need to monitor our CBC or blood count. Sometimes we may need to check for titers, for antigen, antibody, as well as blood typing, especially when administering RhoGAM, right? Because we want to know, is it positive, negative? So is it type A, B, O, positive, or negative?